Hello, and welcome back to this scientific ethics lecture on diseases and their causes. And so hopefully you took a look at the readings and the lectures from the previous core class session where we talked about kind of how the body works. Now what we're going to take a look at is, some things that can go wrong with the body and kind of use this as a kind of a starting point where, maybe some of these scientific approaches we're going to take are going to try to understand disease a little bit better. And ultimately, if we can understand the cause of a disease and what's going on in a disease, be able to treat the disease and prevent pain, suffering, and death. So if we take a look at this, and again, we're going to take a look at this as a primary focus from the United States, but keep in mind that these are problems that are found kind of across the world. And so within the United States, and again, similar to what we've talked about previously, we report per capita, so it's going to be a deaths per 100,000 people, and so it's going to be normalized. And if you take a look at these statistics across different countries, it's going to be organized in the same same way of looking at it. And so if we take a look at a slide like this, what we can see is that heart disease and cancer are by far the leading causes of death within the United States. And so the way we read a graph like this is that the dark blue line that we can see here are the numbers for 2016. The lighter blue lines are 2017, and those are the last ones that are published that I could find easily. And so what this means is that for every 100,000 US residents, we would see 165.5 deaths in 2016 and 165 deaths in 2017. Similarly, in cancer, for every 100,000 people in the US population, we would see about 156 or 153 deaths due to cancer. And so if we take a look at these leading causes, and they, especially if we get down a little bit further through here, these may shift around from year to year, and they did based on 10 years ago, last time I looked at this in great detail. But many of these are kind of in the same pattern. And so take a look at these diseases in an effort to try to understand, at least at a very high level, what is going to be causing kind of the breakdown of the body function. Remember, think about this from the perspective we had after the last lecture of how the body works. So the leading cause of death, we said, was heart disease. Some kind of common problems we've got with heart disease are things like atherosclerosis. So this is kind of associated with kind of plaque buildup, cholesterol buildup, fatty deposits that are building up in the arteries. They make the arteries kind of harder to kind of expand. It makes it difficult to pump the blood throughout the body. And it also kind of narrows the arteries and can result in kind of blockage of the arteries. And so that's bad, especially if we're in a situation where, you want blood to be delivered to regions of the body. And so if you block the artery off, you're not going to be getting blood to the cells that need it. And so cells can become, sick, or in many cases, they can die, especially if the blood vessels that are blocked off are going to the heart or to the brain. And so this atherosclerosis then can really disrupt the blood flow to the heart. There could be heart arrhythmias, and with the heart arrhythmia, you're basically looking at an irregular heartbeat. And so if the heart isn't pumping properly or pumping kind of incorrectly, it's not going to be as efficient as it could be at pumping the blood out to the body. And in doing so, it's going to overwork the heart, put strain on the heart, and cause problems. And then a final example of heart disease is cardiomyopathy. And this is often kind of associated with atherosclerosis or other damage to the blood vessels, because the heart has to pump harder and harder. So you end up with this kind of thickening or enlarging of the heart muscle, which again can disrupt the normal function of the heart. The second leading cause was cancer. We talked about kind of cancerous growth a little bit in the previous lecture. Cancer comprises a whole wide range of diseases that are basically kind of characterized by the fact that the cells that would normally kind of grow out and stop growing kind of at a certain point are going to be uncontrolled. They're going to uncontrolled growth. They're going to continue to divide, continue to produce lots and lots and lots of cells and produce a tumor. And so if it's a situation like this, where you've got a tumor, and this one's growing on the side of the face, it's a benign tumor. So it's basically kind of cells within the sweat gland that are growing out. Normally they'd be kind of embedded within the skin of the face, but because they continue to divide and divide, they form this tumor. And because it's benign, we can basically go in and kind of remove the entire tumor without the risk of it spreading, but still it needs to be kind of intervened with. Other types of tumors would be malignant, and what a malignant tumor would be is, instead of just growing right here, you would have some of these cells that would kind of break off of this kind of cluster or clump of cells within the tumor, and they would spread normally within the lymphatic system, which is basically a drainage system for fluid within the body. It's outside of the circulatory system. And so those cells will end up in the lymph nodes, and they'll start to grow there. And they'll go further on in the body, and what you end up with are these tumors in a whole range of different areas of the body. And so instead of having just one location where it's relatively easy to go in and surgically remove it, they're going to be scattered throughout the body, oftentimes in a difficult location to be removed surgically, and so it has to be done with chemicals or radiation. Accidents, unintentional injuries were the third most common cause of death in the 2016-2017 period that we take a look at. So that's primarily unintentional deaths, or things like motor vehicle accidents, accidental poisonings, as well as falls, and then a whole range of other things here. And so these aren't necessarily disease associated with causing an illness or a death, but these are things that we need to kind of recognize and respond. And so, trying to decrease the number of motor vehicle deaths would be things going in and, putting in seat belts, putting in airbags, putting in anti-lock brakes and collision avoidance systems and things like that, to again kind of strengthen the automobile that you're driving in, make it a little bit safer, and I hope to kind of decrease these accidental or unintentional fatalities. Chronic lower respiratory diseases, probably the most common one is chronic obstructive pulmonary disease, COPD. This is associated with things like emphysema and chronic bronchitis. So what you have is the idea that in order for kind of the lungs to work, to get oxygen kind of into where it needs to be in these air sacs, so that the oxygen can get into the blood and circulate it through the body, you got to be able to bring it in. So breathe in, kind of comes in through the nose and the mouth, down through the trachea, into these deeper aspects of the lungs, and in these air sacs we see over here, with blood vessels kind of wrapped around them, the oxygen within the air is able to get into the bloodstream and be transported out of the lungs to the rest of the body. In emphysema, we've got damage to these air sacs, and because of that, we don't have a good area for exchange occurring, and so therefore we are not as efficient as getting oxygen into the blood supply as we need it. Something like chronic bronchitis, what we're looking at is that these air passageways, almost like, again, tubes that are going to be bringing the air from the outside down to the deeper aspects of the lungs, are going to become narrowed or partially clogged with mucus. And so it's going to be more difficult to get the air in and exchange the air, good air in, bad air out. As we're doing that, and again, decreases the amount of oxygen that's able to get into the bloodstream and circulate through the body. And again, a decrease in oxygen is going to make it very difficult for many of the other cells in the body to work properly if they're not getting in as much oxygen as they need. Cerebrovascular disease, a little bit different than heart disease, but we can see the same types of things going on here. So we can see like a narrowing of an artery that's, we said, contributed to some of the cardiovascular disease when we were talking about heart disease earlier. So we've got a narrowing of the arteries and their plaque. But what we can see is that when we've got this narrowing of the artery, occasionally these plaques break free. and when they break free, they're going to be floating around. And the way the circulatory system works, you're going from large vessels to smaller vessels to smaller vessels to the area where we're actually going to get the oxygen out to the cells that need it. And if you've got one of these plaques in a larger artery, it's going to flow kind of along the path, and ultimately it's going to get into a smaller and smaller artery, and ultimately that plaque is going to kind of clog it. And if that's the case, especially if we're looking at to the brain or to the heart, you know, we talked about heart disease earlier, but we're taking a look at the brain here. If this kind of blocks off, this clot forms and blots off the blood flow to the brain, you can end up with either a transient ischemic attack, which is kind of a temporary blockage. And so it kind of goes there, but then it works its way loose or breaks down and blood supply is reestablished. Or you can have a full-fledged stroke where you've got disruption of blood flow to a region of the brain, and that region of the brain goes into shock. It potentially can have very detrimental effects, as those cells that are starved for oxygen and nutrients could end up dying. And if those cells die, it becomes very, very difficult for them to be, at least the function to be restored with these loss of the cells. Another example of cerebrovascular disease would be like a subarachnoid hemorrhage, fancy name for saying somebody hit their head, an area within the tissues kind of covering the brain have kind of torn their blood vessels, and we've got bleeding in the brain. And so basically that blood is going to be accumulating within the skull, but there's no way for the skull to kind of expand. And so as that blood, as that fluid accumulates, it's not going to be pushing out on the skull, it's going to be pushing down on the brain. And the act of pushing down on the brain, again, can damage those cells of the brains and can cause some neurological problems in those patients. Alzheimer's disease is coming in at, I think, about 6 in this list of things. And so with Alzheimer's disease, what you're looking at is kind of a widespread death of cells within the brain. And so we've got a normal brain over here, and then we've got a brain, at least an artist's sketch of a brain with a person of Alzheimer's. And again, what you can see is that, you know, certain regions of the brain are diminished. And so that's because the cells have died in that region. And those are cells that are involved with kind of memory and cognition, which is why patients with Alzheimer's disease often have dementia, because they've lost the cells that are kind of controlling that normal function. And again, this is a very debilitating disease, because these patients basically kind of lose their selves and lose their cognitive abilities before they would actually succumb to an illness. So in many cases, they're overall healthy in other ways, but they can't care for themselves and they can't remember things. And in many cases, they can't remember the people around them or the lives they've had. Diabetes and the problems associated with diabetes are another common cause of death. In that what you have are people having difficulty controlling their sugar levels within their body. One way to treat a version of diabetes is to use insulin. Insulin is a hormone that's normally produced by cells, special hormone secreting cells within the pancreas, so that after a meal, those cells within the pancreas release insulin, and insulin results in kind of taking that nutrient, taking those sugars from the bloodstream and moving them out of the bloodstream into cells to either use it or store it up. And consistently or chronic high sugar levels can result in really, in most cases, permanent damage to blood vessels, to structures within the kidneys, structures and nerves. And so, you know, diabetes in and of itself isn't kind of causing the disease and death. Well, diabetes is a disease, but it's not causing the death, but it's these long-term effects of the damage to the blood vessels, the kidneys and the nerves that put these people at increased risk for a whole variety of conditions. Influenza and pneumonia, and these days we're tossing COVID-19 at this point, are diseases that affect the lungs of the patients, and these again are serious lung infections. So the patients that have this have difficulty breathing, because they have difficulty breathing, they're going to have less oxygen getting into their lungs. Less oxygen in their lungs is going to correspond to less oxygen that's going to be distributed throughout the body. And so because of that, it can have kind of a pretty dramatic effect on the rest of the body. Both influenza and pneumonia, pneumonia's got both viral and bacterial causes, but all of these are infections that can be spread. What's interesting is this is an archive photograph of an individual working during the Spanish flu influenza pandemic in 1918, which we're hearing a lot about now. And you can see a situation where they were actually wearing masks then, like we're wearing now, at least in portions of the country. Kidney diseases, kidneys, you said, were very important as a filtering mechanism. So they're normally going to be there to filter waste materials from the blood. And so if you've got damage to the kidneys, they're not going to work as well at filtering those things out. And so as you can see, diabetes over here is a predominant cause of kidney disease. High blood pressure, because the high blood pressure kind of damages the capillaries within the kidneys and interferes with their filtering mechanism. And so those are the predominant causes, but there are a whole variety of other causes that can do it as well. And if the kidneys aren't working properly, we have to have the situation where we have to get those wastes out of the body in some way. And so these patients will often go into dialysis where they are hooked up to the machine draws blood out of their body, filters it by using a dialysis machine, which basically is a complicated way that they can kind of pull out the waste materials without affecting the things that need to be found within the blood, so that they pull out the waste materials, and then at the other end of the machine, blood is returned to the patient that's been cleaned or filtered and removing the waste. Suicide, again, a predominant cause of death. Lots of factors contributing to this. This is an area that has increased very dramatically over the last 10 years. And so again, this is not necessarily a disease, although there are a lot of disease conditions that contribute to depression, and untreated depression can contribute to increased risk of suicide. But this is a major public health issue, and it's one that we need to be able to kind of recognize and support, not directly with medicine, but with support networks and other kind of interventions to assist the individuals, that they're able to kind of come up with kind of alternatives rather than kind of looking at the very negative aspects of their lives and considering suicide as their best option. Septicemia is a bacterial infection of the blood, and basically what happens here is that bacteria that kind of normally get into the body are going to be located in one region, and the body's be able to kind of mount an immune response to it and kill off those bacteria. You may be sick, but not too bad. In septicemia, what happens is the bacteria get into the bloodstream, and because they're into the bloodstream, they're going to very rapidly spread throughout the body. The bacteria in the blood are going to be very happy bacteria, because there are a lot of what they can use as nutrients within the blood. So they're going to be able to grow and divide very, very quickly. And so what you end up with is this widespread inflammation that kind of overwhelms the ability of the body to fight it off. Associated with that is the bacteria kind of build up, and their efforts of the body to kind of fight it off is that you end up with blood clots, and blood clots can cause disruption of blood flow into different organs and can result in organ failure. And so if you disrupt the organ, it's not going to be doing the function it needs to do for the body, and it can result in very devastating and very rapid disease progression and death. Normally, septicemia is something that requires hospitalization with high doses of, in many cases, intravenous antibiotics to get the antibiotics into the bloodstream so they can kill the bacterial cells that are in there. Bacterial infections are also, as we said, common illnesses that are normally treated with antibiotics. And so antibiotics are natural or man-made chemicals that are used to kill bacteria. But if we take a look at this, and again, this is a little bit of a commercial, but I'm the instructor, so I can get away with that, or at least as long as I don't do it too often. If we take a look at, the way antibiotics have been used, over the last 20 or 30 years, people would go to the doctor's office and say, I'm sick, give me an antibiotic. And in many cases, they would get the antibiotic, maybe start to feel better, maybe get the antibiotic, and it was something that wasn't treatable with an antibiotic. This is why you can't get an antibiotic if you've got a cold or a flu. But what happens is the widespread use of these antibiotics has resulted in a lot of antibiotic-resistant bacteria. And so, again, you can see some of this in the news, not as recently, but about 2-3 years ago now, there were a couple good examples of kind of the flesh-eating bacteria that wouldn't respond to antibiotics. And you saw some people that were infected with it. Some people died. Other people ended up having some pretty dramatic amputations in order to kind of eliminate the infected regions of the bacterial infected regions of the body in an effort to try to save the rest of the body. And so these antibiotic resistant bacteria are really harmful to the population as a whole, because they're not responding to what we would normally use to kill off the bacteria. Viral infections are similar to bacterial infections. Bacteria are little cells. Viruses are actually the RNA or the DNA, so those nucleic acids that we talked about kind of a little bit in the last lecture, covered by a capsule or an outside covering that are going to get this into the body, affect the cells, and then the viruses use their RNA or DNA to cause the cell to make more copies of the virus and spread the disease even further. These can be treated in some cases with antiviral medications, specialized medications that go in and kind of recognize some of the enzymes that the viruses use and kill them off. And so examples of diseases with viruses are like the cold, the flu, chickenpox, HIV, and now we can add coronaviruses like COVID-19 to this. Again, viral infections that are getting a lot of attention at this point. So that's kind of a quick overview of at least the most common types of diseases causing death within the United States. The readings for this, and again, we finished up with the textbook, and so we're going to be supplementing this with additional resources that you're going to be able to download or read on the website. And so the Centers for Disease Control and Prevention has a healthy living section, which is a pretty good source to read. And then there's also a Healthy Living Medline Plus put out by the National Institutes of Health. So again, take a look at these areas. And I'm not going to be quizzing you about any of this, but I think it's good information for you to have in order to be able to understand what diseases are and how it is that we try to kind of prevent them. Again, the best way to kind of cure a disease is to avoid getting it in the first place. And again, that's something we're seeing a lot with this discussion about COVID-19. So that finishes up this lecture on diseases and their causes. As always, if you have questions, feel free to email me. Thank you and have a great day.